Have you ever had that nagging, persistent abdominal pain? The kind that sends you to doctor after doctor, only for them to tell you they can't find anything wrong? It's beyond frustrating. Well, today, we're going to dive into this. We're going to explore the incredible and often hidden connection between what's going on in our minds and what we physically feel in our bodies.
And, this isn't some rare fringe issue. The numbers are actually kind of staggering. Some studies show that as many as 1 in 3 people experience something called functional abdominal pain. That's really just the clinical term for real physical pain that doesn't have an obvious, visible medical cause. 1 in 3.
So, let me ask you again. Does this sound familiar? You know the pain is real. You're feeling it every single day. But all the scans, the scopes, the blood tests, they all come back perfectly normal. It can honestly make you feel a little bit lost, maybe even make you question yourself.
But I want to be really clear about this. You are absolutely not alone. In fact, this whole situation is one of the most common reasons people go to the doctor in the first place. This search for answers often kicks off this long, drawn-out cycle of appointments and tests that, unfortunately, can lead to even more questions than answers.
So what is really going on? Well, the key to unlocking this whole mystery lies in understanding one of the most incredible systems in our body, the gut-brain connection.
To really get this, we've got to tackle a word that gets a really bad rap: psychosomatic. It sounds complicated, but it's simple. It comes from psyche, which means mind, and soma, which means body. All it means is that our emotional world, our stress, our anxiety, can create very, very real physical symptoms. It absolutely does not mean the pain is all in your head or imaginary.
And let's just hammer this point home because it's the most important one. The pain, the bloating, the cramps, the discomfort, it is all 100% real. You are feeling it. The cause just isn't where we've been trained to look for it. It's coming from a different but just as physical source.
Okay, so how does this actually work? It's all thanks to something called the gut-brain axis. The best way to think about it is like a super busy two-way superhighway of information. You've got nerves, hormones, and all these other signals just zipping back and forth 24/7 between your brain and your digestive system. What happens up here directly, and I mean directly, affects what happens down there, and vice versa.
So let's break that down. How does stress actually become physical pain? Well, when you're anxious, your brain pumps out stress hormones like cortisol. That cortisol can literally change the rhythm of your gut, causing it to spasm or slow right down. At the same time, the chronic muscle tension you get from being stressed creates this constant underlying physical discomfort. And for some people, past trauma can even put the gut's nerves on high alert, ready to fire off pain signals long after the event is over. It's all connected.
So once you understand this connection, you can start to see why the typical medical approach sometimes falls short. In fact, it can accidentally create a whole new set of problems, trapping people in what you could call the cycle of endless tests.
And this thing is a really vicious feedback loop. Here's how it works. It starts with the persistent pain. So naturally, you go looking for answers with more tests. But when those results come back negative, instead of feeling relieved, your anxiety spikes. You start thinking, oh my gosh, what if they miss something? And that anxiety, it feeds right back into that gut-brain superhighway, making the original physical symptoms even worse. And then the whole cycle just starts all over again.
And this cycle isn't harmless. I mean, sure, there are the obvious risks, like radiation from scans or complications from procedures, but the bigger risk, honestly, is that it reinforces that deep-seated fear that something is terribly, terribly wrong with you. And the real irony is that this intense focus on finding a physical problem can actually delay you from getting to the real root cause of the pain.
So, if that's the problem, what's the solution? Well, it really requires a shift in how we think, moving towards a whole-person model of health.
See, the old way just searches for a broken part, a structural disease. It totally ignores your mind and your life context, and it often ends with that frustrating sentence, "We can't find anything wrong." The better way is something called the biopsychosocial model. Think of your health like a three-legged stool. One leg is your biology, one is your psychology, and the third is your social world. If one of those legs is shaky, the whole thing gets unstable. It shifts the entire conversation from "we can't find anything" to "okay, let's look at the whole picture."
And often the first, most powerful step on this new path is something really simple: validation. Just hearing a doctor or a therapist say, yes, your pain is real, and yes, what you are feeling matters, well, that can be profoundly healing all by itself. It's what breaks that cycle of self-doubt.
So once that foundation of validation is there, we can start to explore some real evidence-based strategies that can bring genuine, lasting relief. So on the mind-focus side of things, cognitive behavioral therapy, or CBT, is incredibly effective. It's not about ignoring the pain, it's about giving you practical tools to change your relationship with it, to reframe your worries and break that mental habit of constantly scanning your body for symptoms. Other approaches, like psychotherapy, can help you do the deeper work on root causes, while some people find that hypnotherapy can really help calm those pain signals.
And at the same exact time, we need body-focused strategies. This means things like eating a healthy diet to support all the good bacteria in your gut, getting regular physical activity to burn off stress, and practicing things like mindfulness or meditation to calm that whole nervous system down. And this last one's really important, gradually getting back to your normal activities. It helps break that cycle of feeling and acting like a patient, which can unintentionally keep the pain going.
So, the real takeaway here is this. There's no single magic bullet. The best, most lasting results almost always come from a combined approach. It's all about tailoring a plan that uses therapy, lifestyle changes, and stress management in a way that fits your unique life and your unique situation. Now, it is incredibly important to be super clear here. This whole approach does not mean you should ignore your body. There are definitely red flag symptoms, like the ones you see on the screen, that always require immediate medical investigation. Things like losing weight without trying or persistent vomiting. You have to talk to your doctor about those to rule out other serious conditions first. And this really brings us to our final thought, which is a powerful way to reframe what it means to be healthy. Sometimes, the most scientific, most logical, most effective thing you can do is look beyond the scan and look deeply into the story of your life. Your stresses, your joys, your entire history.
Because in the end, your symptoms aren't just some random medical puzzle. They're clues. They are a form of communication from your body. So, I'll just leave you with this question to think about. What story are your symptoms trying to tell you?